Hello, welcome. We'll just give folks a few minutes to get logged in. Thanks so much for joining us. All right, maybe we'll give another 30 seconds and then we'll get started.
Thanks, Jen. Okay. So I'm going to make a start. My name is Alison Cox. I'm the Policy and Research Director at the Global Climate and Health Alliance. And I want to thank you all for joining us today. I know there's not much time. Before I go any further, let me just say, for those of you who would like interpretation, please press the globe sign and choose your language, choose Spanish. Okay, so I'll just continue with the welcome. So again, we're in the final days in the countdown to COP26. It's been a long wait with the year hiatus last year, but we're nearly there. So, and I'm sure many of you have been incredibly busy with activities in the build-up to this COP. So thank you for finding time to join us today for this pre-COP briefing. We're just going to do a quick scene set in a moment, and then we're going to run through health and climate advocacy, you know, the essentials of what you need to know going into COP26. My colleague Jess Beagley is going to talk us through that. And then we're going to talk about some of the events and ways that you can engage, whether you're at COP26 in Glasgow or watching virtually from home. Jen Cool is going to walk us through various events that are going to be happening and how you can engage with them. And we've also got colleagues from the Healthcare Without Harm, Health and Climate Network, and Students for Global Health, who are going to talk us through some other activities and events during COP. So hopefully that will give you a taste of what to do and some links of where to find more information. So just some quick updates of what we've been up to. And the sort of build up to COP. Many of you have been involved in the development and then the promotion of the Healthy Climate Prescription Letter. This is the letter that is being signed on to by health professionals and health professional organisations around the world. The latest count, we hear that we now have 535 organisations who signed on, which is just massive. This includes the International Dental Federation, which brings in another 1 million health professionals to our list. So certainly north of 45 million now, 46 million could be said, professionals represented in that letter. In terms of how we're getting that letter, we launched it in Geneva on the 11th of October. Dermot Campbell-Ledram has been cycling. Some of you have been following him on social media, been cycling from Geneva to London with the WHO's report and our letter. And he handed it over on Sunday to a group of UK health professionals from the childcare specialists from children's hospitals around the country. And they are now in day 3 of their cycle ride from London to Glasgow. They're on the way, I think, from Birmingham to Sheffield, but hopefully they've arrived in Sheffield by now. And they're also taking their message around air pollution and concerns for the future health of the children they care for in that letter. And they should be arriving in Glasgow on the 31st, on the first day of the COP. So please do be following them all on Twitter and supporting them where you can. And also there's been clearly a big ramp up in terms of activity. We're going to hear more about these different activities, but you'll all have been aware of the Lancet Countdown report last Thursday with the huge weight of evidence that brings, and they're having a range of regional policy briefings that are being rolled out. So watch out for those. On Monday, Healthcare Without Harm with their Race to Zero Healthcare Climate Challenge partners had a big launch, and I'm sure our colleagues Antonella and Andrea will speak to that, but talking about more commitments from the health sector towards net zero. And the Health and Climate Network launched their cross-sectoral call on Monday and are promoting that. So again, Alison will speak a bit more about that and events around that happening at COP. So that's just to give you a taste of the ramp up of health and climate advocacy that's going on out there. And we're going to talk now about the advocacy activities actually at COP and then the events that you can engage with. So without further ado, I'm going to hand over to my colleague Jess Beagley, who's our policy analyst. Jess.
Thanks so much, Alison, and thank you everyone for joining in this busiest of busy weeks. Just a heads up that we will be talking about lots of documents and events today, and there are links for them. And we've compiled all of these into one document, and we'll share that at the end of the call, so that you don't have to frantically worry about saving them from the chat. A bit of background to COP26. I'm sure lots of people are familiar with it by now, but this will be there'll be up to 30,000 participants if all goes according to plan, which I think is large even for the scale of COP. It'll be the first COP since updated and enhanced NDCs are due to have been submitted. Not all countries have done this, although all countries should have done, but this really enables the world to see how close we are to being on track to meeting the Paris Agreement. So the negotiations will take place in that context. COP26 was of course postponed due to COVID-19. It was supposed to take place in 2020, and it means it's been 2 years since COP25. So the agenda is especially packed and is also taking place against the backdrop of COVID-19 recovery. COP26 also marks the start of the global stocktake. This is the process for taking stock of the implementation of the Paris Agreement, and will assess the world's collective progress towards achieving the purpose of the Paris Agreement and its long-term goals. The next global stocktake will be 5 years after this one. To speak a little bit about health advocacy priorities, the overarching objective we have here is to reach some common ground among the health community and to have health arguments used by parties in negotiations to support strong outcomes. So if these asks resonate with you, and we hope they do, then it would be wonderful if you could be using them in conversations and events that you have throughout COP. And there are 4 key headline framings. The first is closing the 1.5 gap to stay alive. Of course, 1.5 is crucial for the climate, but it's also crucial for human health. And the points that we want to be emphasising here, and these will be in an advocacy briefing that you'll get the link to. Health is really supposed to be, we don't want health to appear as an additional ask to policymakers. We want health to be a supporting argument for ambitious climate action. So our 2 asks under closing the 1.5 gap to stay alive are to consider health co-benefits when developing NDCs and other policies, and to deliver a rapid and just transition away from fossil fuels, beginning with immediate cuts to subsidies. And I should say that the way also that we came up with these advocacy recommendations was to try and fit asks that we'd heard commonly used by the health community into a COP framing, so that they're in the language of the people that we're trying to reach at COP, more in the language of negotiators. So if they look a bit different to our usual asks, then that's why. Priority 2 is providing financial support for vulnerable countries to tackle the climate and health crises. And here, points that we want to emphasize are to be scaling up financing to at least the $100 billion that was previously committed to enable vulnerable nations to respond to climate change and its health impacts. and also within that financing discussion, and to ensure more balance between mitigation and adaptation. There's currently a very low proportion of international climate finance allocated towards adaptation, with strong focus on mitigation. And of course, many vulnerable countries in the world need to be supported to be able to adapt to climate change. Priority 3 is to leverage the unparalleled funding being invested in COVID-19 recovery packages to avert an even greater threat to health and economies. As far as I'm aware, COVID-19 recovery isn't a formal agenda item at COP, but it underlies all of the discussions that will be ongoing. So very much relevant for the broader nature of COP. And under this, we are calling for a commitment to a healthy, sustainable and just recovery from COVID-19, really placing an emphasis on equity, and also calling for preparations to be made for the inevitable next global pandemic. Priority 4, finalising the Paris Agreement rulebook to operationalise the most powerful global agreement to protect people and health. To protect people and planet. This is definitely the most jargony agreement, the most jargony priority, and I want to break it down a little bit. And for anyone that's not familiar with the Paris Agreement rulebook, the Paris Agreement was adopted back at COP21, but discussions on how to actually implement the Paris Agreement and to deliver on the goals that are set out in it are still being discussed. They're not yet finalised, and that is, of course, vital for ensuring that progress is delivered and that the goals of the Paris Agreement are met. A particularly contentious issue here relates to the regulation of carbon markets. And our ask here is that regulations for carbon markets reflect economics and health savings. And it's really key that the language in the text of the rulebook that relates to carbon markets includes reference to the right to health, the human rights, and also Indigenous rights, which are of course human rights, and that will, hopefully ensure that there is broader alignment with the else that the health community would prioritise. And finally, submission of updated and enhanced NDCs is important as often as needed to protect people and planet. Although the Paris Agreement says that NDCs must be submitted every 5 years, this hasn't actually yet been set in stone, and there will be discussions on this at COP. And the key issue being that if there is a long amount of time between NDCs being submitted and updated, there's reduced accountability. And something that relates to at least 2 of these priorities is, of course, decarbonisation in the healthcare sector, which is something that I know the health community recognises as an excellent and valuable ask. And that will also be reflected in our advocacy communications. Could I have the next slide, please? Thanks ever so much. And in terms of keeping track, there'll be another briefing for people who are attending COP in person on Friday, and we'll go into a lot more detail on logistics there. So this slide is really about how to keep track of what's happening at COP from afar. If you haven't already joined the COP26 Healthy Climate WhatsApp group, please get in touch, and we would love to help you to do that. IISD also produces an excellent resource throughout the COP called the Earth Negotiations Bulletin, and do all the hard work of digesting negotiations so we don't have to. It doesn't have a health slant, so there is still value to following the negotiations more closely if you are able to, but it is a really valuable resource. Similarly, the Eco newsletter by Climate Action Network is very helpful too. On social media, you can look on Twitter for the Healthy Climate hashtag and the Climate Prescription hashtag. Those will be used by people that are tweeting from COP. And we look forward to seeing those of you who will be attending in person on Friday, and we will give some more information then. And at this point, I will hand over to Jen. Thank you very much.
Thanks so much, Jess. So I'm going to leave my screen off for a moment because my internet is not spectacular. There's a lot on the go, as I'm sure you have realized. And so I'm going to start by sharing with you how to find the public calendar that we're doing our best to curate. So if you go to the GCHA website, and again, all of these links will be in this document that we're going to share with you at the end of the call. But if you go to the GCHA website and you click calendar, you'll see the calendar page. And we have all found that it's much easier to see what's going on if you click the week view. And then I'm going to click one more time. And that gets us to all of the programming that we have been able to curate so far. I think that the current, there's something up with the time zone, so I need to address the way that this is showing up. But as you can see, we've got the WHO is hosting a number of events, both from us and our partners, and we've got those on the website. We've also added a few of the events that our partners are going to talk about to this calendar, and we're going to do our best to keep it updated throughout the upcoming 2 weeks. So with that, we're very fortunate to have a few of our partners here who are organizing events at COP. So I will turn it over to Alison. I will turn it over. Yeah, go ahead.
Sure. So thanks, Jen. So we're now going to move over to our colleagues Antonella and Andrea from Healthcare Without Harm, and you're going to, thank you very much for joining us. Do you need to share any slides, or are you just going to speak to the group? So
yes,
when you're ready.
I'm going to be sharing in a second, if that's okay.
No problem.
There we go. Can you see the slides?
Yes, thank you.
Hello, everyone. I'm just out of the World Health Summit, so Andrea is going to represent us, but thank you for having us with you today.
Right. So thank you so much. Thank you, Alison, and everyone at GCHA for the opportunity for this 5-minute presentation. And thank you so much to Antonella for being here, since she's representing us at the World Health Summit, as she just said. So very quickly, as a bit of context for the activities that we're going to be highlighting for you today, and most of this has already been said by Alison, by Jess, and by Jen, but just to be very clear that there is a very intense health agenda at COP26. It's the first time in the history of COP that health has been so front and center in the negotiations. And this is just a momentum that we need to seize and make the most of. And what we're seeing is really a growing health movement for climate action, where everyone is involved. So governments, healthcare facilities and systems, and of course, health professionals. So just highlighting that, again, for the first time ever, the COP presidency has selected health as one of its scientific priorities. And part of this has been putting out the COP26 health program in association with, of course, the World Health Organization and other organizations such as Healthcare Without Harm. The COP26 health program consists of 4 initiatives, 2 of which are aimed at governments. So they are for governments to present national commitments on the one hand, building climate resilient health systems, and on the other hand, sustainable and low emissions health systems. So far, we've got over 20 national commitments that have already been formally submitted to the presidency, and we hope to get many more by COP. Then also, as Alison was saying, we have the Race to Zero, which has a health component. And through Healthcare Without Harm's Healthcare Climate Challenge, we've got more than 50 healthcare facilities and systems who collectively represent more than 11,000 hospitals and health centers that have joined the Race to Zero, which means they have committed to reaching net zero emissions by 2050. And most of them have committed also to halve their emissions by 2030. So that is huge. And also finally, and won't get into detail here, and probably the latest numbers are the ones given by Alison, but of course it is huge also to have over 45 million health professionals represented in the healthy climate prescription in that letter. And this is just part of a bigger momentum. Of course, we have the WHO special report on the health argument for climate action that came out a few days ago. We had, of course, a big push from scientists and from the medical community to get out these joint editorial in more than 200 medical journals published, calling for leadership on climate action for health. Of course, the Right for Their Lives campaign that Alison presented. And this is just a taste of everything that's happening. And so with that context, let me just give you some highlights of the activities, and very much support that everybody on this event goes to see the GCHA public calendar, which is a lot more comprehensive than this, but these are just a few highlights I wanted to bring to your attention. So on November 3rd, we have the COVID-19 and Climate Smart Healthcare event, which is where the World Bank will be releasing its COVID-19 and Climate Smart Healthcare report, which Healthcare Without Harm co-authored. So we're very happy to finally see it released. Then on November 4th, as you know, as many of you might know, the Climate Champions are hosting a series of events called the Futures Lab. And there will be one Futures Lab on climate smart healthcare for a healthier planet on November 4th, where we will have 3 panels, one focusing on people, one focusing on technology and innovation, and the third on systems. But the whole point is to just reimagine how healthcare will look like in the future. Then on November 5th, we have the Climate Smart Healthcare Delivering Sustainable and Climate Resilient Health Systems event, which is hosted by the Public Health Foundation of India, Healthcare Without Harm, the Health and Climate Network, and many others, which will focus on country, regional, and facility level experiences, and very much on policy solutions for climate smart healthcare. Then on November 6th, and I won't get into detail here because I'm sure GCHA will be presenting this in length, but of course we have the Global Conference on Climate and Health, where we will be participating as well, and just highlighting here that it will be a hybrid event. So very much encouraging everybody that won't be able to attend Glasgow to, register online and participate online. Then on November 8th, and this is really key, we have a Financing Climate Resilient Low Carbon Health Systems event, which will be a closed door conversation with donors. And the idea is to get some pledges so that there will actually be some financing to support the implementation of the COP26 health program. That is aside from the technical support that they will be receiving from WHO, Healthcare Without Harm, and others. And then finally, the crown jewel on November 9 is the Climate Action for Health event. This is a presidency event, very high level one, where the countries that have committed to the program will be announced. We will have representatives, there will be ministers of health, Dr. Tedros will be attending virtually and the like. So this will also be streamed. So we will be sharing all of the links for people to join online as soon as they're available. And just finally, inviting everyone to go to this website, healthcareclimateaction.org. This is our bespoke climate and health microsite, where you will find all of the information on the COP26 health program, Race to Zero, and a lot more. And just really wanted to also say that we will be branding all of our activities at COP with the slogan, Act Now for Climate and Health. And of course, really pushing the hashtag healthy climate on everything we do, so we can join this broader movement that GCHA has been leading. And just before I finish, Anto, is there something that you want to add?
No, I think you covered everything. Yeah, we have a lot to do. One thing that I can say, if we have 1 minute, that I just got out of the World Health Summit, where WHO presented a commission on economics for health for all and climate. I can tell you that it was all around the 3 days about next pandemics, biodiversity, access to healthcare, gender, and how climate change is key to all of that. And this commission, they created this economics commission with all women. Mariana Mazzucato is there, Kate Rayworth is there, that some of you may know. And I think that's probably one interesting thing to look at, what they just launched today, because it's part of the G20 negotiations that are coming this week. And I think it's probably one thing that we need to look at.
Thank you so much, Antonella, for that update.
I have a weird light with me, sorry. Yeah.
Really, really interesting to hear that live from the World Health Summit. And Andrea, thank you so much for talking us through all those events and so on. I'm going to move on now to Alison Doig from the Health and Climate Network, and you're going to talk us through planned events and the cross-sectoral work that you've been really focusing on.
I'll just share a couple of things. Okay, I hope you can see, can you see the Paris Climate Change Agreement screen there? Yes.
Yeah.
As was briefly mentioned earlier, that the Health and Climate Change Network is a really new network, and the aim of the network is to get health people talking to energy people, or talking to food people, or talking to transport people, really, and vice versa. So getting health people into events, that are led by transport sector people that really are talking in that space, but also getting people from all those sectors into health events and into health. Into that health discussion, so that the breaking down the language barriers, the jargon barriers, and really getting them feeling comfortable speaking in each other's space, because it's only really by that joint action on energy and moving out of fossil fuels and on sustainable diets and healthy diets, by working together increasingly. So the aim is of the Health and Climate Network is to get that overlap. And we have got four separate briefings. So one on on energy for climate and health, one on transport for climate and health, sustainable and resilient food systems, and then on climate smart health systems. So those, I'll share the link to those briefings, but the most recent thing has been pulling these together through the call to action. We had a call to action which really tried to get signatories from across the world and from across those sectors. So and it was the Paris Climate Change Agreement, an urgent priority for global health. And that had 5 different asks within it. So that's the demand for global governments to provide affordable, carbon and pollution-free renewable energy for all, for a transition to healthier, climate-friendly transport systems. So that's often active transports, getting people out of cars, making transport systems around people, not vehicles, but out of cars and onto walking and cycling. Shifting to sustainable food production and healthy diets, building sustainable, climate resilient, healthy health systems, delivering care when and where it's needed. So that's the for all again. And then, as was stated earlier for the GCHA and their work, is investing in a green and healthy economy by reorientating finance towards sustainable priorities. That's getting the COVID recovery, for example, resources to look at both climate and health together. Now, if I can stop. So we're going to be taking those asks to the COP through 4 specific events. All of them will be taking place in the blue zone. So that's at the WHO COP26 Health Pavilion. So if you're in the inside, but the good thing is also that this year they're providing these as hybrid events. So if you're anywhere in the world, you can join online. So I'll share again just to run down the events that we're holding there in that health pavilion. Again, they're around the 4 themes. So we're looking at one with energy and air pollution. You can see the types of partners that we've been working with. So we've got Students for Global Health, C40, which is a cities-based movement, the Clean Air Fund, and the Public Health Association for South Africa are working with us on that. So we've got Global Food Systems 2050 event on the 2nd again in the afternoon with the London School of Hygiene and Tropical Medicine. And World Obesity Federation, amongst others. We're working with a group called SlowCat for our transport work. SlowCat is a partnership for sustainable and low carbon transport, and they're really trying to look at the health benefits of shifting to a more sustainable transport system. And then, as been mentioned, we're working with Healthcare Without Harm on the Climate Smart Health Systems event on the 5th. So all of these have got Zoom links. You can, if you're not in the blue zone, then you can come to one of these events. And there's one other area, if you're in the green zone, so I'll stop sharing that. One other thing is a few of the Health and Climate Network partners are joined together for an exhibition stand. So we'll be rotating that stand between the partners and showing videos of both the impacts of climate change on health, but also those responses and the actors and case studies of actions in response to health. So if you want to go to that exhibition, we're doing with the Students for Global Health, Action for Global Health, the Plein Air Fund, Wellcome Trust and the London School are all involved. So really trying to get this mix up between the health and the other sectors during COP.
Thanks so much. Yeah, thank you, Alison. So that's given us sort of two different types of suites of events from these two different organisations, with Healthcare Without Harm really bringing out the health sector contributions, and Alison and the Health and Climate Network really focusing on those cross-sectoral issues. So we're going to move on and talk about some of the events that GCHA is involved in organising.
Nope, sorry, we've got Amit here to talk about the People's Health hearing.
Oh, thank you so much. Sorry, Jen.
No worries.
So Amit, thank you very much for joining. You're bringing news of the People's Public Health hearing, and you're speaking on behalf of the Students for Global Health. So I'll hand over to you. Apologies.
Thank you very much, Alison. Not a worry. I'll just quickly share my screen now as well. Hopefully you all can see this.
It looks like it's loading.
How about now?
Yes.
Amazing. So firstly, thank you very much for having me. It's a pleasure to be here. I'll talk quickly first about the People's Health hearing and who's organizing it really. So like you mentioned, we will be holding a People's Health hearing, which will be held on the 7th and the Sunday actually during the day. Basically trying to promote again the health justice means climate justice activism that we've been talking about for a long time now. This will be held as a part of the People's Health Summit, which is held by the COP26 coalition as well. So there'll be lots of action going on that week, but in particular what we'll be working on is raising the voices of local communities, people who've been most impacted by the climate crisis themselves. We want to look at exactly, who's been impacted. We'll be getting their testimonies on the types of experiences that they've faced. We'll also have listeners there from the activist community, people such as Ken Henshaw will be there, Harpreet Kaur will also be there, and they'll reflect on these testimonies to express their understanding of how these intersectional aspects of health play, and also again about what we can do to make further change in that field as well. Again, this will be held on the 7th. We'll also, alongside that, be having an online gallery where we'll get the other testimonies involved there as well, through anything ranging from poetry to artwork to videos just talking about the health impacts on different communities as well. We just want to make sure that we get the Global South, and particularly just generally anyone who's been impacted by the climate crisis to the forefront of this issue. Alongside that, we've also been working quite actively actually on health blogs. So Students for Global Health, which is who I represent alongside MedAct, have been working on the Health for a Greener Deal campaign for a while now, over the last year, working in the UK, and an action coming up as a part of the Global Day of Action for Climate Justice, which again is being held by the COP26 coalition. It will be organizing health blocks all across the UK. We've currently got 15 going on, including one in Glasgow. So I hope to see you all joining us there in person on Saturday as well. But again, there's loads of different actions being taken all across the UK, including banner making events and generally raising the voice again of the health community on the ground, really. I'll send a link to both of these events in the chat afterwards as well. But this is just a quick summary as to what we've been up to. Thanks so much.
Thank you so much, Amit. And again, we'll be providing a set of links for all the different events. I know people are also putting things into the chat. and we'll take a look through those and try and make sure we get answers to you. Okay, so I'm going to pass over now to Jess, who's going to sort of try and fill in again some of the events that we've been involved in organising, and also some more information about how you can engage and what, even if you're not in Glasgow, how you can actually participate in some of these events. Jen.
Thank you. And Alison, I have realized I'm in a hotel. My internet's not great. So if you don't mind sharing your slides, the slide deck, that would be really wonderful. And just also to note, I know that we've got the People's Climate or the People's Health Hearing link in our links document, but Andrea and Antonella, I would love to grab your links and put them in there as well, so that people have kind of a one-stop shop. Okay, so we can head on to the next slide. I saw some questions in the chat about the Global Conference on Health and Climate Change. Thank you so much if you've registered. Thank you for your patience as we waited to get back to folks. The enthusiasm and interest in this event has been overwhelming and exciting, and we're doing our best to have both a diversity of expertise in the room, so including folks from transportation, energy, and food sectors, as well as health professionals. And so if we have space for you to attend in person, we will be sending that confirmation quite shortly. If we're unclear yet if it will work out in terms of space, we're going to do our best. We'll add you to the wait list for in-person attendance, but everybody who has registered to attend online will be able to attend online. So we will be sending out that information very shortly. In the meantime, here's an overall draft of the day. We're very excited to have some incredible keynote speakers and as well as experts on health and climate change from around the world. And one of the things that is really exciting about this year's conference is, again, we are picking up on what Alison Doig said, really trying to bring in intersections with other sectors. So we've got 4 solution spotlights. The first one is on financing a healthier, fairer, and greener future. The second one is on food systems and biodiversity. And then the third is energy and air pollution. And the fourth is transportation and cities. Online and in person, we will also have an opportunity for breakout discussions so that you have a chance to speak with your colleagues. One of the things that is very clear anytime we are working with our colleagues in the climate and health space is you are all experts in your own field. And so we wanted to ensure that you had time to speak with each other to connect on around issues that you have shared interest in, shared knowledge of. So we've got 2 breakout sessions. And again, all of this will be available online. We are a registration link is again in this links document we're going to share with you, but we will also be live streaming the conference on GCHA's YouTube. So if you, one of the things that we're in a bit of a tricky space with is that we do have to pay for every person who is planning to attend online. So if you're sort of 40% attending and you've registered to hold an online spot and you think maybe you'd actually just like to duck in for an hour or 2, it would be actually very helpful to us if in that instance you withdraw your registration and join the live stream link. There's no penalty to you if you stay registered, but it would be if you're sort of a halfway attending, the live stream will be easily available and anybody can access that. So that's a small plug. I hope that doesn't make things too confusing. Okay, next slide, please. Thank you. So we've had a couple questions about events in the blue zone and events in the green zone. The WHO pavilion, to confirm, is in the blue zone, and the general public unfortunately cannot attend those events in person. And due to COVID restrictions, attendance in person is going to be quite limited. I think we're expecting about 20 people able to attend in person for each of the pavilion events. However, most WHO pavilion events either will have a registration link that you can join the Zoom for, or we will also be live streaming all of the WHO pavilion events on GCHA's YouTube. So you will have access to the in the Blue Zone events online throughout the conference. I just want to flag 3 events that GCHA is especially invested in. The first, on the second day of COP, is a focus on health in the NDCs, building a future for people and planet. And it will cover the Healthy NDC scorecard that Jess worked really hard on this year, as well as examples of progress being made by different countries in the categories assessed in the scorecard, and will seek to raise awareness of how and why health considerations can be included in NDCs, and to discuss the transition from commitments to implementation. The next event is, I'm going to actually turn to my colleague Milena to briefly say a few words about the event that she's coordinating on NDCs in Latin America. And Milena, you're going to have to unmute yourself. Or possibly it's not possible. Okay. What I will say is Milena has convened an incredibly exciting event with the Euroclima Pavilion, so not the WHO Pavilion. It's going to be entirely in Spanish, and with some really exceptional guests in attendance, including some health ministers. So definitely worth looking out for. We will include, again, the link to access that virtually in this links packet. And finally, the event for the Healthy Climate Prescription that I know many of you signed. As we know, health professionals have mobilized across the sector and around the world, and this will be a session that explores why health professionals have asserted their ethical responsibility to speak out on the need for urgent climate action, and why governments benefit from providing health professionals a platform and listening to health professionals in this context. This session, we're very excited. It will also be the opportunity where we launch and share a video that includes messages from the health community around the world that can also be shared on social media. And so, as I said before, the WHO Pavilion events will be streamed off the GCHA YouTube. And I know that our colleagues at WHO are working to compile a document that includes a summary of all the events, all the pavilion events, as well as registration links for all the events. So once that is available, we will also make sure that you can access that document from our link document. And just looking at the titles of the events and knowing incredible partners around the world are coordinating these events. I know that the International Federation of the Red Cross is participating. We've heard Healthcare Without Harm. I think that I've seen presentations by the International Federation of Medical Students. So this really is an opportunity if you're wanting to tap in at any point during the COP to hear about what's going on. We really recommend tapping into the live stream. Next slide, please. Finally, if you aren't able to attend COP in person, we are working to coordinate at least 3 days of online collective Twitter action. I will say the climate prescription action on November 1st is quite tentative at the moment, but the plan is to have people take a selfie with their own paper that says, I prescribe climate action at COP26. Maybe if you want to include, we will send out further details, but if you want to include your recommendation for governments to take action, or if you want to include why you're prescribing climate action, we're encouraging you to really go with that theme. But again, this is a tentative one. I will follow up with a better guide briefly. On November 6th, the day of the Global Conference on Climate Change and Health, we're planning to have a mass tweet both from the from the conference online or from the conference in the room, in person and online. And Amit, maybe you can confirm this for me, but I had heard that the health bloc was looking at making their core message climate justice is health justice, or vice versa. Is that true? Maybe we've lost Amit. Okay, we seem to have lost Amit. So my apologies. To that point, we are from the conference working to have a tweet storm that amplifies the call of the health folks who are in the march, partially because the message, climate justice is health justice, is clear and resident and isn't something like we're wanting to amplify what that community of organizers is calling for. And then on November 9th, I love the way, Andrea, you put that, the crown jewel of the events, the moment where the UN FCC actually has an event on health. We're going to, I think, likely have that would be a moment when we'll really be amplifying the letter. It's also the day that we have the event I just described, where we're talking about the healthy climate prescription letter. And so I think that it's likely, if we have a third Twitter action, it will be that day really asking people to uplift the letter. We're also working to compile a document that has Twitter handles for government decision makers, so it's easy for folks who aren't attending in person to tweet at their decision makers calling for climate action at COP. So once that's ready, again, we'll share that with you. I think that is everything from me, so I will pass it back to Alison.
Thanks so much, Jen. So I've been watching the questions coming through in the various different places. So thanks to people who've been sharing links. I think there was a question about where you could submit events, and I think for the calendar, and I think Jenny's going to put that into the feed so you can follow that. Yes, I think the thing to say is, because we have the privilege of the WHO having a health pavilion actually in the blue zone, the events seem to be very concentrated into the blue zone, but I think we've highlighted one or two that are happening outside of the COP, including that People's Health hearing and the conference. There is also a green zone exhibition that Alison was talking about, but do look at our calendar and keep updated on that for what else you can do. So just to summarize the things we've talked about, we will be sharing this advocacy briefing that helps to bring together the health themes under the main themes of the COP26 negotiations. So we sort of talk the COP26 language and find ways in for speaking about our issues. We're very keen to identify and bring together the groups of people who are planning to be in Glasgow itself. So if you haven't let us know about that already through the various channels we've been calling you, please do contact us and let us know. And then we're going to be organising another of these, but a much more focused one, or specifically on the ground activities on Friday, which we'll record and share, and again on Sunday, just to try and get us together, because we'll be organising daily briefings. We'll be trying to coordinate with you for intel sharing and for trying to target some of the delegates, actually trying to influence delegates and get the health language into their thinking and messaging during the negotiations. So look out for that and do get in touch with us if you haven't yet, if you're planning to be in COP, and let us know what kind of access you have, which will also make a difference. The calendar, we've shared with you where we're keeping this public website with the events. Please do let us know if you've got events that we haven't captured yet, and do be using that as a place to go to find out more about where you can join and participate. Thanks so much to Andrea for really highlighting this point that actually health is there is a COP26 health programme this year, which really does make a difference. And that this event on the 9th, which is part of the COP presidency's agenda, will be really one to watch out for. We're waiting to hear whether or not That's going to be live streamed. They're hoping so, to the public. But it's quite a big deal to have a health section in there. And we're very proud that we will be premiering this video of health professionals speaking to the core messages of health and climate action, which will start that event. So watch out for that, and then our launch event afterwards. And otherwise, thank you all very much for joining today. I hope we've given you a flavour of the breadth of different types of activity that are happening and the different themes. And I'm just going to pause and hand over to Jenny Miller, our Exec Director, to just give us some closing remarks and thoughts. Thanks, Jenny.
Yeah, you bet. Thanks, Alison. And I think the thing that I would want to take note of is that we as the health community are more organized than we've ever been, and we're really seeing the fruits of that in the run up to this COP. It's just been extraordinary to see, we had over 200 medical and health journals publish concurrently an editorial on climate and health. That's not ever happened before. We have the extraordinary sign-on to the Healthy Climate prescription letter with organizations that haven't necessarily been involved before, but are seeing the urgency of this issue and have signed on, and we're speaking with one voice in force. We have the extraordinary work on health systems that's been bringing both private and national health systems to make commitments to net zero. And we have an extraordinary number of events and activities happening at COP. We also have the cross-sectoral work that is bringing health and other sectoral groups together to speak to the health issue. And then, as Alison was just noting, we have an actual health program within the COP. I think this kind of momentum that we're seeing now is due to work that many people on this call have done for years and years and really laid this groundwork. But I've never seen this kind of health voice coming together, this organized, going into a COP to really make the case for health and climate change, for ensuring that health is protected through climate change, but also making the health argument for climate action more broadly. We've got a voice, our voice is being heard, and it's just extraordinary to see that. And I'm really looking forward to seeing how that plays out over the next couple of weeks while we're there, both for those of us who are going to be in person, and I think internationally, we all have a role to play to really, take advantage of that momentum we've built and make a big noise about climate and health throughout COP.
Great. Thank you so much, Jenny.
I just
wanted to again.
Yeah, sorry, I was just going to jump in quickly again, just to thank Antonella, Andrea, Alison, and Amit for joining us to share about your events and for all the work you've been doing behind the scenes to bring people together, and also to everyone on this call who was really part of the efforts this year, which I know Jenny just said, but I wanted to, because I had outreach to speakers, wanted to highlight you're giving us time in a very busy time. So thank you.
Yeah. Well, here. Thank you, Jen. And thank you to our speakers today and for all of you joining. I hope you found it a useful briefing. We will be sending out this document with all the links. If you haven't managed to copy it from the chat, we'll be sending out the advocacy briefing. And I know our colleagues have shared with you some other places where you can get really good information about their programs. So for those of you who aren't able to copy the links, we will send it out as a follow-up message so you won't miss out. So, right, well, it's going to be a tough one, this COP. We really hope that bringing the health voice will help bring some progressive outcomes from it. So thank you for your efforts and for being with us tonight. Thank you.
Thank you, and see you soon. I think that.
Bye.
Bye,
Thank you.
everyone. Thanks, everyone.
Have we ended the recording?